So, benzodiazepines, the class of anti-anxiety medications such as Xanax and Valium, are having a serious moment in pop culture, but they're not without controversy or risk. Now, women are using these medications vaginally to try and treat pelvic pain. Well, gynecologist Leah Millheiser joins us with more on this growing, disturbing trend. So, to start things off, can you explain pelvic floor hypertonic disorder and how common is this condition amongst women here in the United States?
I am seeing this disorder on a daily basis in my practice. I specialize in women's sexual health and menopause. So this is a condition where the pelvic floor essentially spasms. This isn't an acute muscle spasm, this is a chronic spasm, and it can be caused by many different things.
So why are women using benzodiazepines like Valium for this?
If you think about a muscle spasm, benzos are used to treat acute muscle spasm. It's not going to work in the vagina. You're putting a suppository filled with this medication, and this is usually made in a compounding pharmacy. We don't understand how well it absorbs, what the onset of action is, and even if it's addressing that muscle spasm in the pelvis, because it's got to work through the central nervous system. So is it really making its way there? So there's this idea that if you use this medication vaginally, and we have seen in one study that it did improve high-tone pelvic pain, but interestingly in that study they were also doing pelvic floor therapy and trigger point injection. So they said they did see improvement, but the question is, where did the improvement come from? So when you look at a newer study that came out that compared benzo in the vagina, so Valium in the vagina, to placebo, they did not see any improvement whatsoever. So the question becomes, is this safe? Do we understand how it's working? Do we have the potential for addiction? Because we know that benzos, like Valium, can be quite addictive.
You're an expert, you treat this all the time. You don't believe in this treatment?
We just don't know enough about it. Right now, the literature is showing us that it probably has no benefit whatsoever. So for me and for many of my colleagues, we're deciding against recommending it. But pelvic floor physical therapy really is the mainstay of therapy. Botox can be effective. Trigger point injections can be effective. I think we should stay away from the vaginal benzodiazepines until we really understand whether or not they're working.
And Dr. Isha, I'm interested in hearing what you have to say, because you don't know exactly how much of these benzodiazepines you're getting in your system. And then we have to mention that it's such a slippery slope. The minute you combine this class of drugs with other drugs or alcohol, it's a recipe for disaster.
For disaster, because Valium is one of the most addicting medications we can prescribe because it works so well. And if you're mixing it with any other drugs, especially alcohol, 1 beer, 1 glass of wine, 5 milligrams of Valium, all the same thing. And you're not going to realize that you're mumbling and bumbling and stumbling through your day until it's too late.